Hi everyone. Sorry I got dropped again. I'm not sure what's going on with my connection. My name is Natasha Mom MD. My full name is Natasha Sriraman. I'm a board certified pediatrician, a breastfeeding medicine specialist, and I specialize in postpartum depression and anxiety. I am here this afternoon from Norfolk, Virginia. I am an academic pediatrician. That means I work in an academic setting. I do see patients every day, but I also am involved in academics. So I teach medical students and pediatric residents every day, as well as doing research, writing papers, and publishing. And I get to speak around the country. My two favorite topics are postpartum depression and anxiety, as well as breastfeeding. And a lot of times, both of those aspects in the fourth trimester are so important. So, and I think what's really exciting is that because of my passion relating to maternal child health and what I like to call the fourth trimester, I really get to teach physicians to be and early physicians the importance of mom's physical health, but also mom's mental health and how that affects our patients who are the infants, the babies, the toddlers, and things like that. Huge shout out to MHN Network and cherishedmom.org for asking me to come and speak. So my name is Natasha Sriraman, and I actually trained in New York City. I met my husband in Brooklyn, and I trained in New York City. So I'm actually talking today about postpartum depression and anxiety, postpartum mood disorders in moms, who speak Spanish, Latina women. And you may be wondering why I was asked to speak about this topic. I am not Latina. I am Indian. My parents are from India. I was not born in this country. And I think for various reasons, I relate to a lot of our mothers from different countries and different cultures for various reasons. I moved to this country when I was young. I was a baby. But based on kind of where I was raised and where my parents moved after they finished their training, it was interesting because we faced a lot of sometimes racism. There was definitely differentiation in how health was perceived, just seeing it in my own family and friends in the Indian community, and then seeing how health and wellness and kind of the taking in health advice really differs on really a lot of cultural factors. Then you pair in linguistic factors. I am trilingual. I am fluent in Spanish, and I speak my parents' language, which is Hindi. So I think that's another thing that I'm very passionate about this topic. So in terms of how health and wellness is perceived based on whether it's familial, cultural, but also the linguistic, and then for many cultures, including that of India and Pakistan, religious aspects are important. And I think unless you're aware of it and unless you know to ask about it, a lot of people aren't aware of that. And I think for me, training in New York City and being able to speak 3 different languages was really beneficial to me on so many levels. And now I'm in Southern Virginia. I'm in Norfolk, Virginia at the Children's Hospital. And while it is diverse, it's not as, our city is not as diverse as, say, New York or Miami or Los Angeles. The fact that I get to teach learners every day, whether it's medical students or early physicians, early pediatricians still in their training, really highlighting the fact that health and wellness is, we can't assume how we may feel as a person or how we were raised in our family or in our culture or in our society is going to be the same. And, there's a lot of terms that go with it, whether it's cultural competence, cultural humility, all those kind of topics and those names, people have been trying to characterize it for many, many years. But whatever you call it, it's just being aware of how, as a physician, when we go in and talk to our parents about their children, you have to understand we're with them maybe 15, 20, 30 minutes. They're going home to that. And, we may be telling them something, but it may not vibe, or it may not be part of their culture. And they may not agree to it, but we want to open that dialogue. So to give you an example, in a lot of South Asian cultures, in a lot of South Asian cultures, religion has an aspect in how maybe you feed your baby or how things are perceived, or even the gender of the physician or healthcare provider. And there's a religious aspect to it. There are different religions that view breastfeeding differently and things like that. So, we can go in and say, you need to do X, Y, and Z for your baby, but that may not align with their cultural values. And so the reason I'm here talking today about postpartum depression and anxiety in Latina moms, and huge shout out to this warrior. I'm going to have her introduce herself. Is really how postpartum depression and anxiety may manifest differently in Latina moms, how cultural beliefs and societal beliefs may prevent them from asking for help. As we all know, with all these great advocates and all these organizations, before I was saying I got cut off, is how wonderful it is to see everyone on social media so active for Maternal Mental Health Week, all these different organizations all over the country, all over the world actually. And it's so heartwarming for me to see, both as a pediatrician and as a mom who struggled with this 16 years ago. I was just talking to my social workers in the office before I left, and she goes, no one ever asked me about this. I said, yeah, no one knew to ask us back then. But I think especially with my practice, because I speak Spanish, to be able to develop that trust, but also, for many of our families who English is not their first language, we also have to think of healthcare access and availability. A lot of the moms that I may be taking care of, they may not have access to insurance. They may be scared to ask for help because of legal issues or immigration issues. And I think that's something that we have to be aware of. And I find myself fortunate for various reasons. I find myself fortunate that I get to teach medical students and residents about this, because they're going to go out there. And whether they're a pediatrician or whether they become an internist or whether they become an obstetrician, I want at least one piece of that to stay with them. And second, I think, which is the most important to me, is that these mothers are trusting me, not just with their children, which are their jewels, but also with the fact that they're coming to me with maybe some of the other fears that they have, whether it's societal or familial, and asking for help. So I'm going to stop talking. I'm going to have you introduce yourself.
Oh my gosh. Hi, I'm Maureen. I'm so
Hi.
excited to meet you.
Thank you so much for joining me.
Oh my gosh, to moderate this and to learn from you. It's an honor. I'm just happy that you're out in the world doing what you do, and that you're here
Oh,
to
thank you. Oh my
bring
gosh,
a
you're so
lot of
sweet.
light to this topic, because it's really important, and so many women are suffering in silence, and I think that you can really
Yeah.
help to shed a lot of light on that. So I just want to
Yeah.
say
Thank you. And I think
amazing to have you.
you're in Miami?
I am. I'm in Miami,
Yeah.
so I work
Yeah.
with a
So
lot of
yeah, you obviously see, I mean, we have, definitely in Norfolk. I'm in Norfolk, Virginia, which is Southern Virginia. So it's not as much as what I was seeing in New York City. But it's different. And I think depending on the state you're at, and in terms of resources, I mean, Miami is going to have a lot more bilingual resources than, some other Southern states. And so that's been a change for me as well. And I think the important, thank you for, the group to have me on and speak, is that, while the Edinburgh is a great tool, and it is translated into Spanish, remember, when things are translated, and we do screening tools for everything from, postpartum depression to, infant development and toddler development to teen depression, you have to understand that it's really translated word for word. It's not taking in the cultural nuances. So for instance, in our office, we have the Edinburgh in English and Spanish ready to go. And that's great. And then if I have a mom who speaks Hindi or Mandarin or things like that, we'll print it out in their language. But remember, this screening tool is just that. It's a tool. It's not going to give us the answer like, yes, you're depressed, or no, you're not depressed. It's a way to open up the conversation and to normalize it. And I think for a lot of the mothers I see, depending on societal factors, economic factors, immigration factors, they're going to be scared to ask for help. And, study after study, like I was kind of looking things up again last night. And, I think the general consensus is 1 in 5 women, 20% of women can suffer from postpartum depression. It's the most common complication of childbirth. But, there have been studies that have been done in Miami and Los Angeles and New York where there's a higher volume of Latina moms. And, it's actually shown that, up to 45% of Latina moms can suffer. So that's, twice as much. And you also have to think when it's self-reported, that's a bias right there. That's self-reported.
Yes.
So there may be a lot of moms not identifying. But if you think about that, 45%, so almost 50% of women, in this country, whether they identify themselves as Latina. I don't know if Spanish is their first language or English is their first language, but they're suffering. 50% of women. And, depending on when your OB follow-up is, I know everyone on social media is talking about this. And the reason I got into this as a pediatrician is because a lot of moms just, didn't depend on race. It didn't depend on age. A lot of it, sometimes it depended on insurance, access. The next time you're going to see, so how many visits do you have when you're pregnant? Like 17 to 19?
Oh my gosh.
My kids are older, so I'm trying to think back.
Yeah.
17 to 19, you would say?
More than 10 at least, yeah.
Yeah. So then you have the baby, and then when's the next time you see the OB?
Maybe one more time. Yeah.
6 weeks later.
Yeah.
So the reason I got into this is because I am seeing that baby, like in the first month, I could see a baby 3 times. In the first year of life, I can see a baby 7 to 9 times. So I have the access. Who is trusting me with their baby? Who's coming to the visits most of the time? It's mom. I mean, dad might come, grandma might come, but, generally speaking, it's going to be mom. She's trusting me with her most important, asset, her jewel. And I have that because I'll be honest, like, when I'm doing the newborn visit and I'm there for 15, 20 minutes, I mean, full disclosure, I'm always running late. I'm never on my 15-minute schedule. I'm always running late because I spend a lot of time talking to my families. 9 times out of 10, the baby's fine. There may be some jaundice. There may, we may just have to discuss feeding or breastfeeding. But most of my visit, especially those first few visits, is with mom. And having that trust is such an honor for me that they trust me with their feelings and their thoughts. And then I think I feel lucky because I can speak the language. I don't need to use a translator. I don't need to use an iPad because, that is a barrier. I mean, obviously that's needed. I mean, sometimes. And I don't speak Mandarin, so I'm going to have to use an iPad or a translator. But that barrier and just making sure they know it's okay. Because just like in Indian culture, I'm of Indian descent. In Hispanic culture, I see this with my moms as well as my teenagers, and I have to talk to their moms. There's a huge mental health stigma. I'm preaching to the choir here. Everyone knows this. And there's
what is it? Can you tell us? What is it? What is the stigma?
The stigma is that, and I just had a mom today, and she was of Caribbean descent. And I talked to her, and I explained to her, my cultural, and I said, I get it. And I think it's the brain is not part of the body. I think it's we're supposed to get through it. And then if you look at a lot of the beliefs in Hispanic culture, the Marianismo, like this is part of motherhood, and kind of you're supposed to be the martyr, and this is all part of it. And what I like to say is, when mothers either are taken off their medications or don't take their medications, whether it's during pregnancy or postpartum because they're breastfeeding, and what do we say? You're just supposed to get through it. You're supposed to get through it. And what I tell the moms is well, if you had asthma, would I take you off your asthma meds?
Wow.
If you had high blood pressure, what? Of course not. That's ridiculous. So why do you go to the dentist? Why do we go to the dentist twice a year? Not because we're having tooth pain. We're trying to prevent all that from happening. And whether it's a postpartum mom or a teenager, I'm having this discussion all the time, but the head is part of the body. And I think I'll be honest, I see it in Indian culture. I see it with parents. I see it just within my own, larger family, just like, it's almost like a deficit to go to therapy and things like that. And I think with postpartum depression, whether, you're white, black, Indian, Hispanic, what are we supposed to do? This is the best time of our lives. How can you feel bad? You shouldn't feel bad. This is a beautiful time in your life. So you add on that mom guilt, and you add on that feeling of something's wrong with me because I'm not doing it right. And then you add in the culture, and then, a lot of the beliefs, cultural beliefs, amongst many of our Latina moms, and maybe it's not something that you believe, but maybe it's your mom, the baby's grandmother or extended family. I know in my culture, a lot of people will come from India or, extended family will come and help out. And I'm sure it's the same thing, with various cultures. And it's this concept of like malos de nervios, like you're supposed to hang on and just get through it. And it's like what I call like white knuckling your way through it.
Yeah.
And you're supposed to get through it, hang on, malos de nervios, and hang on and just hope, just get through it. I'm thinking, well, would I just tell you to get through your asthma attack?
Oh my gosh.
No. Would I tell
Yeah.
you to stop? Like, just get through the high blood pressure and we'll get through it. Of
Wow.
course not. So I think I think the Edinburgh is important. And of course, it doesn't align for these cultural issues like malos de nervios or that
Right.
feeling of Marianismo, like you're supposed to be the, you know,
Well,
Mary, like the martyr.
there are different words too, right?
Hmm.
Like
Yeah,
depression, that's a very like Western cultural idea. And like women from other cultures might say they're overwhelmed or stressed
right.
out. Like what are some of, right? Like there are other words that women use to describe this, not I'm depressed or I'm anxious or
Right. And I think also to your point, the words are different and also the manifestations are different.
wow.
Like you may not be sad, you may be having a headache.
Wow.
Your pain, you have the somatic symptoms, which we see, it's actually quite frequent in medicine. It's just we weren't trained like that back then. And I think definitely, of course, people are much more aware, but, it's like, oh, the stomach ache. I mean, how many of the moms out there, their kids have a stomach ache and they don't want to go to school? Well, you find out, maybe someone's not getting along with them or they're getting bullied, that kind of thing, those somatic symptoms. And I know with a lot of Latina women, it may manifest as a somatic symptom, like their pain isn't getting better, after delivery and things like that. I'm not saying to rule out, of course, we want to make sure that
Yeah, yeah.
the physical pain, and I think for a lot of my moms that I see because of immigration, because of economic issues, because of insurance or lack of insurance, when your obstetrician is going to screen you at 6 weeks, do you have insurance at 6 weeks?
Right. It cuts
What if you
off.
don't have insurance or if it cuts out? And, I think you don't see that in Miami. We didn't see this in New York, but I think like pockets like Miami and New York and LA, you have the resources, you have all these wonderful physicians and nurses and front staff and social workers that all speak Spanish.
Yeah.
I mean, I'll be honest, like a lot of moms don't feel comfortable talking. They don't feel comfortable going back to the hospital because they didn't have a translator. They didn't feel the perception is they weren't treated well. So they're not going to go back. And so a lot of times I'll ask my moms why they didn't go back. And because of the language barrier, they don't even know who to call, like what phone number to call, especially in these bigger cities when, there's lots of physicians and residents and you don't know who's coming in and out of the room and things like that. Of course it may be different in these like smaller hospitals or maybe like more rural areas. And just, so it's just everything compounds. And I love the fact that MH, Network asked me to talk about this topic because it's a topic I'm so passionate about. And and I love that, with everything going on with this week, with Maternal Mental Health Week, we're really addressing the cultural aspect, which is so important. And I think, like the tool, it is important, but it really opens up that discussion and it makes it okay to talk about it. I'm
Right.
not saying you need to go to therapy. I'm not saying you need medication. I'm not saying you need a I'm not saying any of that. I'm saying that we talk to all new moms about this. We're not singling you out. This is okay how you're feeling. I have to make sure that you're safe, that you feel safe, the baby's safe, and maybe just getting more sleep. Maybe joining now all the support groups are virtual, but
Yeah.
I know a lot of the postpartum support international and these other larger organizations will have support groups in Spanish. I think that's definitely lacking. I don't know about Miami and New York, but that's definitely lacking because I think that's a barrier for moms to get help because if they can't find that support group that maybe they're speaking in Spanish, that's also a barrier.
Yeah.
I think one thing we have to consider, especially in various cultures, and even with Latina women, regardless of religion, when you use a translator, and this is what I really talk to my not even just my medical students and residents, but even my other physician colleagues, which again, they weren't aware of because they didn't train in a big city or they just weren't. So, when I'm talking to a mom about breastfeeding or obstetrical stuff or postpartum, that's really sensitive, right?
Yes.
We women talk in a different language
Yes.
and they trust me. So if I walk in and I don't speak Spanish or I don't speak their language and I pick up the translator, iPad or phone, and no one ever realized this, and it's very interesting to me. What if it's a man translator, right? So they're talking to that person in their language.
Mm.
And so all my partners are using a Spanish translator. They can't speak Spanish. So you don't get to pick. And you always want to highlight the fact, like, we're talking about sensitive topics. Like,
Yeah.
they're going to talk to a woman, but you're putting, it's me, the patient, and here's the triangle, right?
Yeah.
You can't put a man on there. You're not talking about the baby's, diaper rash. Like, that's different. You're talking about mom's personal feelings and how she's just managing, or you're talking about breast pain, or you're talking about, C-section pain or delivery pain or an episiotomy and mental health. Like, I mean, I don't know if I would feel comfortable.
I
I
hope
don't know
you
if I,
train. Are you?
I
Do
mean,
you train pediatricians? I feel like.
I do. Yeah. So I,
Oh,
so I teach at a medical school.
okay.
So all the medical students come through our clinic as because you have to do pediatrics regardless of your, whatever you're going to specialize in. And then we have a pediatric residency program. So we have about 22 residents a year. So pediatric residency is for 3 years. So I did all my training in New York City. So I could speak Spanish like in high school and college, but really being in New York City for my training, really my conjugation, like I cannot conjugate future tense anymore at all. My grammar's not there. But the medical Spanish, and I think just, I love my Latina moms because they're so patient with me. And
Oh,
I apologize to them, like, because they start speaking really fast. And I'm like, you have to slow down. You have to slow down.
the
But I think
Puerto
they,
Rican,
oh, who's the fastest? Like,
the
I'm fine with,
Cuban,
oh,
Cuban.
that's it. That's, I went to,
Even
we
in
went to,
Miami,
we
I
went,
don't understand. I'm like,
we went
what
to
are you?
Cuba. We went to Cuba a few years ago, and my kids are watching because we've been to Costa Rica, we've been to Mexico. I got down to Cuba. I stopped speaking Spanish because they would talk so, and I just pretended I couldn't.
It's hard.
I couldn't say I was bilingual anymore. I could not. It was too fast for me. But
Yeah.
they're so appreciative of the fact that, I think being a mom, obviously isn't, endears me to them, but just the fact that someone's
Sure.
taking the time to, speak in their language and things like that. It may take me some more time because, I have to think of certain words. But I think just being aware of that, and whether you're a physician or a nurse or a doula or a social worker, or you work with moms in this space or pregnant moms in this space, you just really have to be aware, because I don't think we get this training. I can't speak for, social workers or nurses. I know in the medical world you may get a lecture on it, but it's very different when you're in it. And for the people who work with me, like my learners, they'll be aware of it and they'll maybe think about it, a year later or something if they come across it. But it's really, who trained you, because you can't learn this from a book or a lecture. And I think, the high rates of postpartum depression and anxiety, and, and I'm saying postpartum, but you have to think, what's the biggest risk factor for developing postpartum is
Pregnancy.
symptoms in pregnancy.
Right.
So are they being asked during pregnant, are they being screened? Are they being asked? I would guess not,
Yeah.
because, when you go to your OB, it's
It's
the OB,
very low.
yeah, and our OBs are very busy, and,
Yeah.
they're focusing on mom's physical health and the health of the fetus. And I think that's for all women. I don't, it's not just for Latina women, but, when you add in the language barrier and,
Now,
because,
what
yeah, go
about
ahead.
families? Families
I lost you.
in different cultures. Do you find they come in with their family, and do you do a lot of explaining to the family? Do you think that's a good route for helping women? And I know a lot of the women I help here are scared to tell their families, their moms and their aunts and their sisters because of the judgment.
Yeah, so I lost you in the first part of the question. You're saying
Oh,
for Latina families?
yeah, is one way to speak with families about it, bring in families. Do you find that they come in with their families? Like, it's the family unit is so important. That's where,
Yeah. I think it varies. Like I think definitely um some spouses are coming in depending on their work schedule. The grandparents I see less of here than in New York, and I don't know if it's because the
oh,
immigration is different. Probably in Miami, there maybe it's easier to bring your families in. I know in New York it was the same thing. Um, and I think it's just family dependent. Like a lot of times they'll be like, can you explain it to him? But they're pretty open. I've never really, I mean, I'm not saying they're open to medication or going to a psychiatrist, but they're
yeah,
open to talking to me about it and acknowledging it and then addressing it. I think what the roadblock is that if they do need therapy, like it's not something that just sleep is going to cure.
mm,
And I think the availability of support groups, if they're bilingual, is very low, at least for in a lot of parts of the country. And I think it's not that they're not open to it. It's just maybe it's a daunting task to find the therapist or bilingual therapist or insurance or transportation. Um, but
it's a
I
lot of
think
burden placed
it's a
on
lot of
mothers, right?
steps. It's a lot
And
of
you're
steps.
taking care of a baby, and like you're not well, and then we have mom try to maneuver her way through this terrible maze, and it's just a terror. It's hard, if she ends up finding that help, she's that's lucky. I'm thinking.
Yeah. I mean, how do you reach out to your moms? Are you with them in pregnancy, postpartum?
So we get the providers to screen, and then if they detect that they are having a complication, then we get them. But it's hard to get them to show up to the support groups, and that's just been like a challenge. And I know like women will be less likely to use medicine. African American women and Latina women, white women are more likely to do it. So we have to find like those low barrier points, like
Yeah.
the support groups, the getting the sleep, just having some language to talk about it, and meditation, like those things. But
Yeah.
so we just have to find what we can grab onto that can
Right. Yeah, I think you're right. The medication is a huge barrier, so that doesn't even really come up. I think the only time really it comes up with me is that they said that they have a history of depression, or yeah, I had this with my first child, and the doctor mentioned something, like it'll come up in the context of like they are aware of it, but they just, you know, yeah, I agree. The medication, and again, I think it's definitely like culturally specific, but even in subcultures within the United States. But it's that thought of there's something wrong with me, and what if I need this forever?
oh
But
yeah.
no one, it's interesting because no one thinks about that in terms of the medicine for asthma or the hypertensive medication. And I've tried to change my language a little bit, like the head is part of the body,
Wow.
and but it's so hard, right? It's so hard because, and I don't know how it would be if I had babies when there was social media. I don't know if that would have been helpful or harmful for me, to be honest. But isn't it, when you come home, you're supposed to have it together.
Oh,
You're supposed to, um, you know, be breastfeeding and up and look fresh and have makeup on and take care of your 2-year-old and, send out the thank you cards for the baby shower. Oh yeah, and then pop back to work at 6 weeks. And it's just not, and I don't care who you are, that's not feasible, nor is it healthy, even on the physical health side, let alone the mental health side. And unfortunately, our postpartum system, like I did a I did a live session yesterday with someone, and they were talking about how, postpartum there was no help, and a lot of times our hands are tied as physicians because it's all based on insurance. It's all based on what's allowed. So I
yeah.
mean, how wonderful would it be, we could tailor it like when the mom delivers, like this is going to be your postpartum follow-up based on
Oh,
what you need. You're going to go once a week for the next or whatever.
oh, I
Or I
love
mean,
it.
or how amazing would home visits be? I
Oh,
mean, who wants to leave the house? Who wants to leave the house with a baby with the first 2 weeks? Especially, I mean, you're in Miami, you have amazing weather, but I mean, I was leaving the house in New York like stormy, rainy snow, and you're
yeah.
trying to get yourself out and a baby and a car seat. and, whatever,
Yeah, so much
I mean,
stress.
I was not one of those moms like who, I just struggled just in general. And then my second is a 16-year-old. And the reason a lot of people ask me like why I got into this, like why as a pediatrician are you doing so much, mom stuff? And it was because of my own struggles. My oldest is 18, my second is 16, and my third is 12. And I struggled with breastfeeding with all three. It was not easy. So, I started learning about breastfeeding and I became a specialist and took the exams because I just wanted moms to have the support that I didn't get. But I think also I I pride myself on the fact that, yeah, I'm a pediatrician and I have the medical knowledge, but I can make the advice realistic because as a mom, I've been through it.
Oh,
Like, I'm not going to say, you have to breastfeed around the clock. Like, if a mom is struggling with depression, anxiety, like, if you want to pump, go ahead and pump. If you want to but someone's got to feed the baby so you can sleep.
yeah.
So I really, it's like empowering moms. Like I want to empower moms in motherhood, and I want to give them realistic advice because I've been through it. And my son so he's 16 now, and he's taller than me. And I had two kids in diapers because they were less than 2 years apart, and no one recognized it. Everyone just thought I was overwhelmed.
Oh,
You have two kids in diapers, you're overwhelmed, all this kind of stuff. And 6 weeks later, I was still crying. And my husband, I love him, very supportive physician. He's in medicine. He had no idea what to do. It was like deer in headlights. And how hard is it for a mom to ask for help? I mean,
so
it's so hard, right? In any circumstance, I picked up the phone, and she was a friend of mine. Like, she was a physician who delivered my two kids. I picked her up. I picked up the phone, and I said, I'm struggling, and they told me to call the phone number on the back of my insurance card.
okay.
Click.
Oh, and that was your friend?
Well, yeah, well, no, it was my
The OB
obstetrician.
that delivered?
Well, the OB actually didn't even get on the phone. It was the nurse who knew me.
Right.
So for someone who knows the system,
Right.
it
Right.
was tragic. Can you imagine someone who does, I mean, it's
Yeah.
crazy. And so when I started doing all this work about 7, 8 years ago, it was because of patients I saw. I was like, there's something not right. I started doing some research. I started writing the protocols. Now
And
I've
what were you
published.
seeing? What were you seeing?
I would just walk out of the room and I'm like, something's not right with this mom. Something's
Real.
just not right. And then I started Googling, and then I found the Edinburgh, and then, it started like patients. And then I started, I met
I
with a
love
friend
you.
of,
I love you.
and
I
then I met
love
with a
you.
friend who happened to be a perinatal psychiatrist. We started doing conferences. I got on the board of my local my state chapter of postpartum support, Virginia. I've spoken
Yeah.
around the world on this now. I've published in
Wow.
scientific journals, and now all of our pediatric practices in our whole system, every pediatrician screens for postpartum depression. And then
Do you know
about,
what the rate is? Have you seen the rates for your?
yeah, it averages around that 20-25.
It does.
Yeah, yeah, it's about, we haven't parsed it out based on, I don't know if we can parse out race data. I don't
Yeah.
know if we can do that. I don't think it's that sophisticated. And then once we started in the general pediatric arena, we started in our clinic, in our hospital setting first, because we're a very busy practice because we have the medical students and the residents. And then someone from the neonatal ICU contacted me, and she's a wonderful social worker. And then they took my protocol, we adjusted a little bit, and now they're screening in the NICU. And
Amazing.
then now all the pediatric practices. And what's very interesting is that I was getting a lot of emails from pediatricians out in the community, who see probably a more homogenous patient population than I do. And they were just fascinated. They were shocked at how many positives they were getting,
Right. Doctors
and
say it. They're like, I don't have any moms, and you're like, just start screening, and they're there. You're gonna find
exactly,
it's one
start
in
screening.
five. Like,
Right, right. And I think for, anyone out there listening, because, if you're a physician or if you work with a physician or a healthcare provider, just talk to them about it. Because when I started all this, a lot of the nurses or nurse practitioners would come to me and say, I think we should do this in my practice, but the doctor is scared of X, Y, and Z.
Yeah.
And, we can get around that. I've written articles about it specifically, but, a lot of times the fear was like, well, I'm the baby's doctor. How can I screen the mom? Because what if something's wrong? We can't write medicine for the mom. I'm not saying that. But wouldn't you want to know if the mom is suffering?
Right, because it impacts the baby, right? It
It
impacts
impacts
more.
the baby, the family. And, my mantra is healthy mom, happy and healthy mom equals happy and healthy baby. And
Yeah.
that's what I tell the moms. And I think, whether it's in English or in Spanish, whatever I'm speaking to that patient, I think when you put in the context of, I need you to be healthy, mom, so you can take care of your baby.
Yeah.
And I think that's, we carried this child for 8, 9 months. That doesn't mean you're stopped. And I feel like that's the tragedy, I think, of postpartum care in this country, is that once the baby is born, it's like the focus is the baby.
Yeah.
Hey, where's mom?
Have you heard
And
that they call the mom the wrapper to the candy, and once you unwrap the the candy, right? You get the candy out, you throw the wrapper away. It's
you
like
throw the wrapper away. Exactly. Yep. Yep.
it's
I
done.
saw that quote. Yep. Yeah. And it's
No.
like, we have to think of it. It's there. It's still what, just because the baby's out doesn't mean they're still not connected.
So
And
what
I
would you
think,
tell like Latina moms out there? Like what would it um you said like you had a word tan nervios or
yeah,
like
like
this is
malos de
part of motherhood.
nervios. Yeah, part of
Yeah.
motherhood. That, yes, I think we have to normalize it, that
Okay.
these feelings are normal, but it doesn't have to be a normal part of motherhood, meaning the suffering.
Mm.
I think we have to normalize that yet. Because, I mean, if you look at it, 40 to 50% of self identified Latina mothers, that's more common than high blood pressure or gestational diabetes.
Right.
So we have to normalize that this is no, this is within normal. And of course, obviously, that's the physician's role to parse out, like, hey, is this something that we can manage with sleep or support groups versus, medication and something more serious, of course, and talking about that and normalizing it. But really, for my Latina mothers and for everyone who works with them, how to open up that discussion with them so it doesn't seem like it's threatening and that we don't lose them. Like, just opening up the discussion, like, I screen all my moms. I saw that, you marked this question, da da da. So tell me how you're feeling.
Mm.
And then for anyone who works in the space, anyone can screen. I think the one big thing is, if you start screening or if you start talking to moms about this, have a plan on where you're
Okay.
going to refer these moms. Because if you do find a mom who is, not doing well, or any type of concerns about safety of mom and baby,
Yeah.
you have to have that safety hatch. We didn't start screening until we knew what was going to happen, because you are going to pick up some moms who are feeling suicidal and things
And
like
what do
that.
you do? What is your safety plan as an example? What's that look like?
So if there's any concern, we had a mom years ago, and I'm in a city that is heavy military,
Okay.
so having a gun is very common. So this mom had those thoughts, and she had access to a gun, and the husband was deployed, and we had to make sure the children were safe, whether it was a family member could come, or in our case, Child Protective Services, because and then the mom had to go to the adult emergency room.
Okay.
And
She,
unfortunately, it's not the most ideal
and she was
situation.
way past, right? It sounds like she was really high. Like,
Yeah, I think this what had been going on during the
right.
pregnancy, and I think the added stress of having a husband deployed. I mean, you have to look at all the other stressors women have in their lives, like divorce, moving, deployment, lack of family support. What's your economic status? There's so many. I mean, obviously the genetic stuff we can't control. Like, obviously there's a genetic component if you have a family history of anxiety or depression, or if you had a previous history of postpartum depression. Obviously, like you said, having symptoms in pregnancy is the biggest risk factor, but all those external factors,
Yeah.
that we can, I can't control if her grandmother had anxiety depression. That's out of my control, but maybe I can control the fact if she doesn't have the social support system or sleep or and things like that. And I think, as a pediatrician, what I see is the the link between breastfeeding and postpartum depression and
You're the
how.
second doctor to bring that up today. The second doctor.
Okay, yeah. So a lot of moms, it's, and I promote breastfeeding,
Yeah.
but for many moms, it's the one thing they can control. Maybe their birth plan didn't go the way it was supposed to go. Maybe things didn't go. And I think we may be seeing more of that now with COVID because you can't control who's in the delivery room with you. You can't control, like, people, grandma can't come and help. So that's fine. Like, I have moms tell me, like, this is the one thing I can do. And especially with our Latina moms, they have much higher rates of breastfeeding because it's culturally appropriate. It's not shunned upon, nursing in public and things like that. It is as it is in the US. So, Latina moms are going to breastfeed more. So what happens time and time again, they are either told or they feel that they have to choose one or the other. Like, they can only breastfeed or they can only take their medicine. And so I'll post a link, but I wrote an article that was published in the New York Times in, I believe, in October, that you can breastfeed and still get treated for your postpartum depression and anxiety. Like, it's not an either or. But I cannot tell you how many times I see that still, and it just breaks my heart. And I think that's a huge thing that we can empower our mothers, that you don't have to pick one or the other. But also, if breastfeeding is making it worse or breastfeeding around the clock is making it worse, I'm in a position to tell them it's okay. You
I
can
see
stop.
that too.
Yeah, you can
You
stop
guys,
breastfeeding, or you can not breastfeed at night, whatever.
fed is best, right? That's what
Yeah,
they said.
yeah,
Fed is
yeah.
best. Breast is best. Fed is best. You're fed
Yeah, I
baby.
mean, you can, like, moms want to breastfeed, that's great, but hey, how about we, pump or, give formula just, for the nighttime so you can get 4 or 5 hours, straight of sleep as opposed, and things like that. But also, who the other family members are, who's going to help out with that. And, like, as we have to sometimes get creative because everyone's family situation and social situation is different. you
Yeah.
know there may, depending on availability of family members, I think that's going to be an issue now with COVID. Night nurses and postpartum doulas, that may be financially inaccessible for a lot of our families. And now with COVID, that's going to be a different situation as well. But I think, what you're asking, so I think anyone who's working with moms in the space, and especially our Latina moms, just to somehow normalize it and have a way to bring it in the conversation, whether it's just even asking the question. I don't think, I have a lot of older physician mentors and I love them, but he goes, well, I don't need to screen. I just ask, Mom, how are you feeling today? What is she going to say? Fine.
Right?
So that was
Feeling
enough for
myself.
him. And, that
Yeah.
was enough for him. And I was like, I was too young in
Wow.
my career to be able to say anything at that point. But, like, that's not, what are we going to say? I'm fine. I mean, how many moms have told you they're fine and you're looking at them like you're not fine?
Right.
Like, you look at them and you're like, yeah, no, you're not fine.
Right.
So, but I agree with you. I think, the medication piece is very still that stigma
Yeah.
amongst Latina moms. So kind of going for that low hanging fruit, like, who can you talk to, or, here's your support group, or get some sleep and things like that. And I think very close follow up. And I think, of course, if there's any concerns that they may need to be evaluated for medication, then, they don't have to wait for that 6 week visit with their OB. Empowering moms to go ahead and make that phone call,
Wow.
you know?
That's really great. And then have you seen like more since COVID happened in your practice, or are you seeing more stressed out moms? I guess it's more understandable, but
Yeah, the anxiety is high. I think, for multiple reasons, like, pregnant moms are nervous because they don't know what's going to happen. Like, I don't know what's happening in Miami, but in New York, they're testing every mom who comes in.
yeah,
And if you're positive, dad, grandma, no one can be there. Here, we're not testing because we're not a hot spot right now with COVID, but they're screening. They're going to take a temperature and they're only allowing one person in. So whether that's your spouse, is it a grandma, is it a doula,
right.
that's stressful. And I think the problem is anything can change in a day.
Oh,
So I could tell you something is going to happen tomorrow, but it may not be next week. So I just try to tell my pregnant moms, I have pregnant nurses in my practice, and she's a first time mom, one of my nurses, and she's like, what should, and I said, right now it's this, but you
Oh,
do have to prepare,
oh,
and then
right.
the policies are different if it's a, vaginal delivery versus a C-section. So C-section, a lot of times they're not letting, regardless if you're COVID or not, because it's an OR setting. It's different. I think the big thing, what I've been seeing is that the moms are leaving the hospitals earlier
Okay.
because either they want to get out or the hospital wants to get them out. So I'm seeing babies much earlier, like within like 26, 27 hours.
You
So
are.
yeah. So, we're not, we're absolutely, we are not doing telehealth visits at all for newborn checks or well checks or weight checks. I think I've seen that around social media. So I try to clarify that at every live that I do. But, we have to check their weight. We have to check their bilirubin. If they're breastfeeding, it's going to be different because, their milk hasn't come in yet. We're going to talk about colostrum. It's
Wow.
probably a little bit too early to screen. Like
Oh,
we're not going to screen a mom, within 24, because still with the baby blues
right.
and things like that. But it's that overwhelming feeling of anxiety. Like I know the baby's going to be fine, but I'm so worried about the baby.
Yeah.
And again, is that identifying, and a lot of moms will reach out to me and they'll be like, so how do I know this is PPD
Yeah.
or versus COVID anxiety?
Oh,
And I think with any type of anxiety, depression, when it starts affecting function, I think that's when we worry. Like,
and when you say
yet,
function, what do you?
well, I think just, are you worrying so excessively that, when your baby sleeps, can you rest? Or is your mind racing? Are you not eating? Like, what do we tell moms? When you feed the baby, you feed yourself. Of course we're going to forget things. I mean, I remember I was forgetting to eat for, a couple hours, but that function of just being able to, you know, look, whether it's feeding your baby or changing the diaper, just kind of being in that space and that moment of just enjoying that baby. And when that excessive worry of, oh my God, someone's, the baby's going to get COVID. Oh my God, and if it's affecting your sleep and just this constant worrying, of course, anxiety is a really common symptom in the postpartum period. And I think, I obviously I know the nomenclature is like PPD, right? I mean, that's the popular,
Yeah.
that's the most known. And while that's important, what I try to do in my social media is I do like PPD/PPA, because
Mm,
I think anxiety is a super common symptom, and I think it's even more common than depression. And I think when we use PPD, everyone thinks they're going to see like a crying sad mom, as opposed to the moms who, I had a mom who took a child like 6 times to the ER in 2 weeks. And then she told me one day, she's like, I don't understand. When dad's home with the baby never gets sick. So she was perceiving that the baby's sick, something's wrong. And then we opened up the conversation and I realized she'd had postpartum issues before and, that kind of thing. So I
oh,
think the anxiety piece is really important, like that excessive worry, making sure you can sleep. And I think we don't always focus on those. I think we focus on are you feeling sad? Are you feeling overwhelmed?
yeah.
As opposed to the constant where your mind is
Instead of the
racing.
worry, are you? I love how you said it. Like, are you able to like rest when the baby's resting, or are you just constantly thinking of the worries that your baby might get sick? Or that's
Right,
huge. That's what it looks like. Women say they're not even sleeping. They can't sleep. They're too scared to sleep.
right. Do you see like the in terms of, because we were having this discussion and I don't think it's really well taught or discussed, the concept of intrusive thoughts with your Latina moms?
If
How
they
does
do,
that?
they won't share them.
No, yeah.
Um, and most women don't share them. All they would say they have anxiety. I remember when I was having them, and there was a Latina mom in California. Her family took her to get an exorcism. Like they were sure that
Mm,
they had people praying over her at the church. Like
right,
uh, so. I don't think women are sharing those
right.
scary thoughts. These are those intrusive, what if thoughts that are women get them. It's
Yeah.
yeah,
And it's pretty common in postpartum. So it's nothing to be ashamed of, but like you said, no one's going to tell you about it because you're going to be perceived as something's wrong with me or they're going to take my baby away. So, I'll ask moms and it may take a couple times to just
do they
for
tell
them.
you?
Eventually they will.
Oh,
Yeah, they'll
they must feel
want.
so freeing for them to say it.
Yeah,
Because
I
you
think
feel
it's like
better when you get it out.
yeah, and I think it's like you just see the shoulders relax.
Total, because they think they're crazy. I
They think
remember
they're crazy.
I'd never had them before, and I was like sure that I was this terrible monster, and I would, but they frightened me so much
Of course.
until
Yeah.
someone was like, "This is normal. It has a name. Like it can get
Yep.
better." You just think you're this terrible person.
Yeah, I had a friend tell me, she's like, they were so scary. She goes, I didn't even tell my husband. And then she
Right.
goes, and then I went to see she was telling me then she went to see a therapist for something else. Like this was, past, the baby was already one. And the therapist gave it a name. And so she was, this was many, many years ago. And she was recently telling me, like, I never knew that. And it still sticks with her to this day. And
It's
I think that's what's sad and incredible at the same time about postpartum is that, my son is 16, my daughter's 18. I still remember how I felt when I called and asked for help and no one was there to help me. And that was you know 16 and a half years ago.
I call it the best kept secret of motherhood.
Yeah. Oh
Like
wow, that's great. That's beautiful.
like
Yeah.
it's this stuff. Well, like we know it, um, but it's such a secret, and women will share it in little pockets. But then you just
Yeah.
feel crazy.
What do you feel like there are good resources for Latina moms in this, perinatal or postpartum depression that may be on a more national level?
I think there's a wonderful group. I think it's Mothers to Babies or Mothers and Babies, and there's an online cognitive behavioral workbook. And I think
Okay.
it's free, and I'm gonna have to post it. And it's in Spanish, and I think that's really great. But
Okay.
I don't think there are any like outspoken Latina women um, like talking about this. When I look for original content on it, I don't really find it. I
Yeah.
don't find it, and it's really just translated material from
Right.
Spanish. So
And anything I've seen, nothing talks about malos de nervios. Or so when I talk about it in these lectures, and if I do lectures for physicians or nurses or lactation consultants, they've never even heard of it. So it's interesting because when you look at the stuff that's even translated, like in the big cities like Miami and New York and Boston, where you have a higher density of Latina women, I still don't see it like when I'm
no,
looking at, yeah. So it's very interesting to me. And, when you look at women like Serena Williams or Chrissy Teigen or, African American women or, Caucasian women talking about it. And I think it's great because it's opened up the conversation. It's exactly what you said. I can't think of in that kind of world of celebrity, like a Latina women talk, and again, is that because they have it? Is it the stigma?
right.
You know,
Is it that
is
what you're saying?
right,
Like that's just what motherhood looks like. You
right,
take care
right.
of
So it's
everything.
very interesting because I think, like you said, that's really powerful when someone with that platform and that voice and that audience can talk about it. And I think I talk about when I started doing this was Brooke Shields.
Yes.
And if you guys, whoever's watching, if you haven't already, her book Down Came the Rain after her first pregnancy is so powerful. And then so I always kind of looked to her and that book when I was, reaching out to moms and teaching medical students. And then when Serena Williams came out with her stuff, that was really powerful for, my African American mothers.
Yeah.
And so I think but I feel fortunate that I'm able to do what I love, and I'm fortunate that I get to take care of mom while I'm taking care of the best patients ever, of course, because pediatrics is the best. And I just, and I feel lucky that I'm able to do it in their, mother tongue of Spanish, and we can understand each other, and if if I can help them, or if they even trust me just to even talk about it, I think that's, I count that as a positive.
Well, it is such an honor to sit here with you today. I would love to meet you one day. I think you are the future of what we need are pediatricians like you everywhere that really know and see that mom needs to be well and for baby to be well and to have a conversation with these moms. And thank you so much for joining us today.
Oh,
I
thank
feel
you
like
so
it's
much for having me, and thanks for moderating.
Oh my gosh, you are such an inspiration. I love you so
Oh,
much.
thank you so
I
much.
love you.
Yeah, so you can find me on Instagram at natasha.mom.md. So if anyone wants to send me a DM,
Yeah.
I'm gonna be posting throughout the week and through this month, but I definitely will be
Dot
posting
M.
about natasha.mom.md, and my website's under construction, but it's like Care for Kids Empowerment for Moms. And really
Nice.
I started my social media presence because of this postpartum period. I like to call it the fourth trimester.
Yes.
So, but thank you for this conversation, because I will be posting, I think about how postpartum looks in Latina moms is really important.
That's
So,
amazing.
yeah, so if there's any questions, or anyone has questions, or just comments, they can DM me over there.
That's wonderful. Well, thank you so much. You've added to this amazing conversation. You brought so much light to this topic.
Oh, thank you so much.
Thank you, guys. Thanks for joining us. I hope you
Thank
loved it
you.
as much as I did.
Bye, guys. Have a great week.
Bye.
Bye.